Hello. So my name is April Vega, and today we'll be discussing ethical dilemmas that I have encountered as a social worker at a large nonprofit organization, providing housing assistance and case management for low-income families. This presentation will apply an ethical decision-making framework to guide how I would address a complex situation in alignment with social worker values and professional standards. Um, To begin with, we're going to do the description of the ethical dilemmas. The organizational the organizations recently reviewed a major grant to expand services. However, the grant requires the housing assistance be prioritized only for families with children and at least one employed adult. This requirement includes single adults, unemployed individuals, and families without children, many of whom are chronically homeless or facing severe systematic barriers, such as disability, discrimination, and lack of access to employment. This dilemma arises because this policy conflicts with the core social work values of service, social justice, and dignity, the worth of a person. While the grant funding is essential to sustaining the organization, implementing these exclusionary policies could cause harm to vulnerable clients. Our client population that is impacted, groups most affected by this would be the chronically homeless single adults, families without children, individuals who are unemployed due to barriers such as mental illness, disability, or lack of opportunity. These populations already experience structural inequities, and restricting services further harms them and reinforcing cycles of poverty and homelessness. The relevant NASW Code of Ethics, uh, there are several guideline principles relevant to this dilemma. The first one would be the commitment to clients. Social workers' primary responsibility is to promote the well-being of clients. The next one would be cultural competence. Social workers should understand and address cultural and social diversity in service delivery. Social and political action. Social workers should advocate for policy, for changes in the policy that improve social conditions and promote social justice. Integrity of the profession. Social workers must act in ways that advance ethical practices and uphold the integrity in the field. These principles, to me, highlight the tensions between fulfilling agency policy obligations and maintaining ethical commitments to serve vulnerable populations and equality. Uh, Ethical decision-making model. For the situation that I was given, I would use the Remers ethical decision-making model. The 7 steps that are included is 1, we identify the ethical issues and conflicting values. The conflict between the value of the service to all the need versus the agency's need to comply with the funder's restrictions to ensure sustainability. Number 2, we would identify the individuals and groups that are likely to be affected. The groups include clients excluded by the policy, agency staff, and the community served. 3 would be identify all possible courses of action. So we would fully comply with funding conditions, advocate internally for policy modifications, seek alternatively or supplemental funding to serve excluded populations, transparently communicate with the foundation about the ethical implications. Those are some of the possible courses of action we could take. Examine reasons for and against each option. We would fully we would fulfill our compliance fully to secure the funding. Advocacy and collaboration may protect vulnerable clients but could still risk losing financial support. Number 5, we would consult with colleagues, supervisors, and ethics committees. This would allow the peer consultation, give us decisions that are made that these decisions will be made in isolation and align with the organization's ethics. 6, make the decisions and document the process. I would recommend negotiating with the foundation to broaden eligibility while exploring community partnerships to fill service gaps. Number 7, monitor and evaluate the outcomes. Ongoing evaluation ensures accountability and minimizes harm to exclude clients. The role and responsibility of a social worker. As a social worker and program administrator, I have an ethical duty to advocate for fair and inclusive services. My responsibility is to protect vulnerable populations while maintaining agency sustainability. This includes transparent communication with the funders and leadership, promoting ethical integrity and ensuring decisions align with professional values. Potential impacts on the clients and the agency. If the organization is forced to reinforce restrictive policies, it risks damaging trust with our clients and community partners, creating a mission drift, shifting from serving those most in need to serving those most fundable, negatively impacting the mental health and stability of excluded populations. Alternatively, advocating for inclusive practices may strengthen the organization's ethical reputation and long-term sustainability. The plan of action would be convene a meeting with agency leaderships to present ethical concerns, proposing a phased approach, prioritize families per grant terms, but use other funding streams to support excluded individuals, engaging in open dialogue with the foundation to explore flexibility and the eligibility criteria that is given to us. And most importantly would be documenting all communications and ethical reasoning for transparency. Strategies to minimize harm would be to strengthen our partnerships with shelters and community health agencies, create referral networks for clients ineligible under the grant, provide advocacy and resource navigation for clients facing systematic behaviors, offer emotional support and peer support for programs to promote resilience. And one of the broader implications and conclusions would be that this case illustrates how ethical dilemmas at the policy level can affect organizational trust and client outcomes. Decisions driven solely by funding can compromise mission integrity, perpetuate inequality. Ethical social workers must balance fiscal realities with professional values, advocate for social justice, and ensure that every decision reflects our commitment to humanity, fairness, and dignity. A lot of times you hear that politics are hard, and I think this is just one of those big examples of having funding available to your clients, but the funding comes with restrictions. When you're trying to help clients, it kind of caps you and tells you what you can and cannot do. So it isn't an all-inclusive, way of helping everybody. Instead, it is a way that donors are able to ensure that the way they want to help people actually stick out. And it can put a lot of barriers and also restrictions on the type of help that we prefer to help. Thank you for listening, and we'll talk to you soon.